Hello, everybody. Happy Hump Day and welcome back to Wednesday Webinar Day. This is the fourth in our webinar series. So we had to take a little break from webinars because, surprise, we had to open About Face up again. And that took a little bit of time to get all the new regulations and just the protocols and procedures down. So we're going on our third week. It's actually probably our first week of feeling like we're open. The first week I went in and just did some real lightweight procedures, did some Botox and things like that to make sure I felt good about what we were going to do. And then Mary joined me, and us two nurses worked out all the protocols and things that we wanted to do with Dr. Thompson. And then Tara came in and gave her input as a nurse just to make sure we all felt good. And then this week we invited back a couple of the estheticians, and hopefully we're going to have the whole staff back working again by the beginning of June. We need them because you guys are anxious to get back in there, and we're so happy to see that. So thank you guys for your support. That has meant a lot to us over this period of closure. And we've gotten just great feedback on the webinars. So we're going to try to do this once a month. There's a lot to do whenever we're doing our work all day, every day. So we're going to try to bring them out once a month. I think you guys are going to start getting so busy, you're not going to have time to watch much more frequently than that. So tonight what we were going to talk about is Skinade, and kind of interesting, we were going to launch these new products from Skinade at our launch event in February. And it just got a little complicated. They were making a change on one of their packages. So we said, that's okay. We'll just do another party. It's going to be fun. We'll do that in May. Well, lo and behold, it's May and we can't party. So we're having a party at home. So glad we could get together this way and do it. But we did want to go ahead and tell you about the new products in case you wanted to go ahead and get started on them. We've been watching them for a long time and we're very excited. So I think you're going to like it a lot. But for those of you that really don't know what we're talking about in the first place, we actually mailed a tasting sample. If you signed up for the webinar and you've never tried Skinade, we just mailed you a little packet of it to taste. So I hope you had a chance to try that if you haven't been drinking Skinade already. If you guys had already ordered Skinade, we didn't bother because you know what it tastes like. It was just a little package of a taste. But I have been selling skincare and I've been working in the anti-aging business for the 18 years that I've owned About Face Skincare, and then many years before that. So I'd say 25 years I've worked in anti-aging with topical products and treatments, and never considered a nutraceutical. I've been asked a lot about that over time, and it is something that we may consider now in the future, but we would want to hire somebody that can manage that knows nutrition. So I had never really considered that at all. I have been asked a lot over time about collagen supplements and what I thought about them and some of the powders, and the studies just weren't overwhelming to me. I would read about it and I would see, that some people saw results. It was pretty much all over the place. So I never read anything negative. And I would say, if you want to take a collagen supplement, I don't think it would hurt you. I don't see consistent results on it. And then Skinade hit the market. So Skinade is actually a company out of the UK that started in 2013. And it was very shortly after they started that we started seeing some results and some of their clinical studies and things coming out that were really exciting about the changes that they were seeing in the skin, in addition to treatments and products and things like that. So when they came to the US in 2016, we thought, okay, maybe it's time to start considering bringing something like this in. But as we do with everything that we bring in, we usually watch it for a little while, just make sure that they've got all the little tweaks worked out with it, and then we bring it in. So about a year ago, it's been a little less than a year ago, we brought it to About Face Skincare and it exploded. We were the top selling medical practice in the Southeast with Skinade. You guys loved it. You could see the results. We saw the results. People who had been coming to see us for a long time and had great skin, just bam, had even better skin. So it was a great addition to the practice. But let me back up a little bit and just explain why we would want to use a product like Skinade in the practice. So we talk about collagen all the time. Every webinar, almost every visit with the office, you're going to mention collagen. And collagen is a naturally occurring protein in the body that gives the skin its structure and support. So the suppleness and the firmness in the skin is because of the collagen in the skin. Collagen gives you that elasticity. So the more you have, of course, the better your skin's going to look. But around your mid-20s, you start to lose about 1 to 1.5% of your collagen every year. And so if you do that math, by the time you're 50, you're going to have about 50% less of your natural collagen. And of course, with women, when we go through menopause, we really see a larger reduction. And that's why sometimes when women have moved into menopause, you do notice that the skin looks a little bit more sallow and a little less supple. So things that you can do about that, it's the things we always think about when we talk about taking care of ourselves. It's the proper nutrition, proper sleep, managing your stress, avoiding the sun. We talk about that a lot too. Sun will naturally break down collagen. Things we can't control. To a certain degree, we can't control our hormone levels. I know we can get supplements and we can see physicians and get hormone replacement therapy, but that hormonal fluctuation does affect the collagen in our skin. And the genetics. Some people just age more prematurely than others. Others look like they're 20 when they're 95, and that's just something that we can't control. So there are a few things that you can't control. But what we do at About Face is we try to stir that collagen pot all the time for you. So that is why we give you products that have retinol and the peptides and growth factor. And that is why we come into the office and we do treatments like chemical peels and lasers and non-surgical facelifting and those kinds of treatments, microneedling, things like that, because we're trying to make the body think it's been injured. So we're doing it's called a controlled injury. We're injuring the skin in a very healthy way so the body produces more collagen to address that injury. So we can do those things monthly, but we can't go around every day and do microneedling and lasers. We would appreciate it if you wanted to, but you wouldn't look very good after a short period of time. It would be too much. So that's where Skinade comes into play. Skinade can be taken orally every day to help the body think it needs to send more collagen to this wound and produce more collagen in the body. So it's not just the skin on your face that looks better, the whole body looks better. You'll notice more moisture in your arms and legs. Everything just feels and looks a little bit better with consistent use of Skinade. So the way you use Skinade, you drink it every single day. They say minimum results will be seen at 30 days and the maximum results will be seen at 90 days. So of course we recommend a 90-day use. And then you can go on a maintenance plan. It's sort of like Latisse. If you've ever used Latisse, you need to use it every day for the recommended time. And then you can use it every other day or every 2 or 3 days just to keep fertilizing it, as I say, just to keep those fibroblasts firing and to keep that collagen going in the body. You'll see a reduction in fine lines and wrinkles, increased skin radiance, and increased skin suppleness whenever you drink the Skinade. Now, if you ask what makes Skinade superior to the one that I'm drinking, and I won't call anyone by name, but there's several real popular ones that I've seen people drink. And so whenever I started looking into Skinade, I was trying to find out exactly what would make Skinade superior to a product that you could just go into one of the stores around here to buy, because Skinade is only sold in a medical practice. Well, Skinade is a liquid form. And so whenever you're taking a powder formula and mixing it with water, your body's only going to absorb about 30% of the material in that solution. So with Skinade being a liquid form, whenever you drink it, you're going to absorb that product much more efficiently. And Skinade is made in a real fine collagen size. So when you drink it, it absorbs into your cheek. You absorb 90% of it in your cheek when you swallow it. And it is made that it can survive in the GI tract whenever you swallow the product. So you'll get much more efficient absorption. The collagen, there are 3 types of collagen. Let me back up and say this. There are 3 types of collagen produced by the body. And creatively, they are type 1, type 2, and type 3 collagen. So type 1 and type 3 are actually the wound responders. You know, we're talking about this controlled injury, or if you actually sustained an injury, the body would produce type 1 and type 3 collagen to go and repair that wound. Now, what we find in some of the other peptide drinks is actually type 2 collagen, which is not the wound responder. So you're not going to get as much of a wound response and therefore creation of collagen that we're looking for in the skin from some of the other supplements. Skinade is a farm-raised fish from France. That sounds like Sally sells seashells. It's a farm-raised fish from France. That is the collagen peptide in Skinade. So Skinade comes in a couple of different formulations. They make these little bottles, trying to make it so the light's not so bright on it. And then they also make these little, they call them sachets, and it's a liquid in this sachet. This is like the tasting test that everybody got at home. But this is not a tasting test. This actually has to be mixed in 4 to 6 ounces of water. So you would tear this open, pour it in, 4 to 6 ounces of water, shake it up good, and then you can drink it. Now, Skinade is made so that you don't have to drink it all at one time. If you want to take your bottle or your sachet and pour it in the big 32-ounce tumbler and drink on it all day, you can. That's not a problem. The only thing is Skinade is affected by caffeine. So you don't want to drink caffeine within an hour of Skinade. You'd want to get up and drink this and then have your coffee, or have your coffee and wait an hour to drink this, because it will affect the absorption of Skinade. So that is the story on Skinade and why it has been so awesome for us. So the company came to us a few months back and said, we have developed targeted solutions. So all of these things that I'm going to talk about, Skinade will address, but they took some of these fine things from Skinade and they expanded on them a little bit to address specific problems that you might have. So the first one I'm going to talk about is called Clear. And Clear is a product that's designed to address acne. So Clear has 21 functional ingredients in it that are going to help with acne breakouts. They're going to decrease inflammation, decrease your breakouts. It's going to help hydrate the skin and reduce the oiliness. Some of you guys may remember on previous webinars we've talked about, and thus from the webinars, I've talked to a lot of you about how your skin is oily and seems to get oilier, but it feels dry. And it's because you're stripping the oil from the oily skin, so the body's saying, oh no, and it's producing more oil to catch up. If you're a person that suffers from that kind of skin condition, Skinade Clear, the targeted solution Clear, would be good for you because it's going to help regulate that moisture in the skin. It's going to control oily skin, and it has a probiotic component that's going to create a more healthy gut. We understand that if you have a healthier gut, you're going to have less trouble with your inflammation and acne. It comes as a 2-step delivery system. So you're going to be getting a sachet and you're going to get a package of capsules. And this is very specific on the instructions. So if I don't sound as clear, you will understand it. And let me just pause to say that if you have any questions on any of what we're talking about, or you need some help figuring out exactly what you need, just let us know. Just respond with an email. You can text the main office number. You can let us know and we'll touch base with you just to help you figure that out. But the Clear comes, as I said, with a liquid sachet and a package of capsules. And so every day you're going to take 4 to 6 ounces of water. You're going to open your liquid sachet and dump it in. You're going to shake it up really good. And you're actually going to see some microsolids in the fluid. That's normal. That is something that you could shake and blend, and it's never going to break down completely because it's an intentional thing. Some of those little microsolids are going to be in there. You'll drink them and you'll never know that they're microsolids. I just like to mention that, so if you see things floating in there, you don't think something's funny about that. And then you're going to take 2 capsules and take your capsules, wash it down with your Clear solution. The reason they do it that way is you want very quick absorption of the liquid product and you want slower absorption of the ingredients in the capsules, the probiotic type ingredients in those capsules. So that's why they put it in that 2-step delivery. It's going to work to regulate your hormones. So it's not a medicine and it's not hormone replacement therapy by any means. It's just natural products that are going to help regulate the hormones. Because if you have an excess of estrogen or you have an excess of testosterone in the body, you're going to see more active breakout. So the fact that it's helping regulate those hormones, if you're taking birth control pills, speak to your doctor before you start taking Clear, because we wouldn't want to regulate your hormones too much and wind up with an about-face baby. And it could be that they need to make a tweak in your birth control pills if you're taking those pills for acne specifically. So it's just a good idea to speak with your doctor if that's something that you are facing right now. There's another study out that is showing that the Clear is having a really positive effect on hair loss. So for some of our PRP hair restoration clients, we are encouraging them to try Clear because some of that hair loss is coming about because of these hormonal irregulations. And if we can regulate the hormones a little bit naturally with Clear, we're going to get a better result with our PRP hair restoration. So that is really encouraging news there. Now, Clear is made with some vitamins that are fat soluble. There's water soluble vitamins and fat soluble vitamins that we can take. And when the vitamins are fat soluble, we like for you to take a couple of week break every 90 days just to let those vitamins clear before you start again. So if you are a person that struggles with acne all the time, that would be a candidate to take Clear all the time, we recommend that you take a 90-day supply and then you just take a 2-week break and then you go back on it again. So these would be people that struggle with severe acne all the time. Maybe you suffer with PCOS, polycystic ovarian syndrome, and you're just looking for something to kind of calm down that complexion and help decrease acne. And you would probably stay on Clear all the time, taking your 2-week break. Now, if you're a person that struggles with premenopausal PMS acne, you might just get the Clear package and you might just take that like the week before you start your cycle, just to calm down that inflammation and to calm down that complexion, and then not take it again for another few weeks. If you're somebody that's struggling with hair loss, you would probably want to be on that full-time regimen just to keep that hormonal fluctuation from happening for you. So that's something where we can kind of help you decide. If you don't want to figure that out on your own, we're happy to kind of talk through that with you. Let's see here. I wanted to let you know, if you wanted to take, with these targeted solutions, you can take Skinade. We love Skinade. We recommend Skinade. But if you're taking the targeted solutions, you can take them along with Skinade. If you wanted to take a round of Clear and then see if you could just take Skinade to support that, that's a great idea, because Skinade has a lot of those same ingredients. Not as many, it's not as strong in those areas as Clear is, but you could see if you could support your function, your acne function, with just Skinade. If you wanted to leave Skinade alone and drink Clear, you can do that as well. So there's all sorts of ways to mix this up. If you decided that you want to take Skinade and Clear and the other two things I'm going to tell you about, you can take all of the supplements. You just have to put 30 minutes at least between each one and stay away from caffeine an hour on each side. Now, Clear has a pineapple passion fruit flavor. They all sound really good. I know I have not tried the targeted solutions. Mine are on the way. Everything got kind of slowed down with the COVID and the deliveries. So mine is on the way. I love the Skinade. I look forward to that. So I imagine that would be delicious as well. Now, the next one I want to tell you about is called A&D Derma Defense. So A&D Derma Defense is going to give you a little kick on anti-aging. And let me pause to say, I clobbered Sam because I thought he spelled defense wrong on all of the marketing materials, but defense in the UK is spelled with a C, and in America is spelled with an S. So you'll see it spelled both ways, one way on the packaging and another way in a lot of the marketing materials. So that is why, for my teachers out there that know that I'm a grammar Nazi. So A&D Derma Defense is pretty simple. It's 3 ingredients: vitamin A, vitamin D, and calcium to help everything absorb better. So lower vitamin A and vitamin D levels in the skin will lead to real dehydrated, real flaky looking skin, a very sallow complexion. So that's where drinking Skinade is wonderful, and it's going to help all of that. But if you wanted to really kick it in high gear and take an extra supplement that will address the skin, even out skin tone and color correction, help with browns, help with reds, and just make the skin look really nice, I would add this A&D Derma Defense. It's going to lead to better hydration, better complexion. Again, minimum 30 days to see results, maximum 90 days. And then you can go on a maintenance regimen, or you can just hold it with Skinade. And if you start not seeing the results that you were seeing, you could go back on a targeted solution, the A&D, and kick it into high gear again and get that glow back a little bit better. It has a coconut pineapple flavor. They've really done well with all their little flavors. It all sounds very tropical and vacation-y. As with the other Skinade supplements, you want to take it, as I said, 30 minutes away from the other Skinades. You just want to give them ample time for absorption, and an hour away from caffeine. All right, and the last one I'm going to talk about, I am pretty excited about, because I feel like this one is the one that we've all been waiting on. This one is called Cellulite. 85% of women suffer cellulite. Not to say that men don't get it, but women suffer cellulite a lot more often than men. Predominantly a female problem. And so the way cellulite happens, if you think about your thigh and you think about the tissue on top of the thigh bone, you have these little, they're called septate bands that connect to the top of the skin and to the bottom there, sort of in the middle, and that's where the fat cells are. And so as cellulite comes on, these septate bands get really fibrotic and really hard and firm. So the fat cells can no longer shift side to side, and they start to show upward. So if you think about like you take a balloon and you put a fishnet over it and you pull it really tight and you see these little pockets bubble up, that's what it's like inside the skin with the septate bands and the fat cells. And so that's what creates that real lumpy bumpy. So cellulite has given us some amazing results. And I would say, just from talking to other people, if you decide to try cellulite, take some pictures of your before, because it's kind of surprising what's back there. I'll have to admit, you don't honestly know what all is going on if you don't take a picture. And it's very nice to see those results. So I would highly recommend you go ahead and take some before photos. Cellulite has 21 functional ingredients to help with cellulite and fat. It comes in sort of like the clear. It's going to come with a liquid sachet. And so you're going to take 4 to 6 ounces of water. You're going to dump your sachet in there. And then they have a little packet of an enzyme activator. And this enzyme activator is called superoxide dismutase. Superoxide dismutase. Clinical studies show superoxide dismutase is very effective in breaking down cellulite. So that's why it's such a popular ingredient in this cellulite product. So you're going to take, as I said, 4 to 6 ounces of water, dump your sachet, shake that up and get that mixed up really well. And then you're going to take your little foam enzyme activator, your superoxide dismutase, and you're going to dump it in, and it's going to be a little bit foamy. Now, water is the enemy of superoxide dismutase. So water will automatically start breaking down that enzyme, but you've got to get the enzyme in the body somehow. So what you do is shake that up. You'll have microsolids again that you're going to see. Dump your foam activator in there, your enzyme activator, and then you're going to drink it immediately. It's not going to be like Skinade and the others that you can kind of sip it until you drink it. You're going to want to go ahead and drink this one all at one time so you get those full benefits from that superoxide dismutase. You're going to see this decrease the appearance of cellulite. You're going to see the fat cells get a little smaller. Those hypertrophic fat areas get a little bit smaller. The most exciting part about cellulite is that in a 90-day period, the average weight loss is 8 to 12 pounds. I mean, who after quarantine 15 doesn't need 8 to 12 pounds weight loss? I was really excited about that. Again, minimum 30 days to see results, maximum 90 days. And the company sort of sees this one, you know, it's fairly new, so we haven't played or practiced with this one as much to know the timing. But we see this one more as like, now, you know, you're wanting to get ready for summer months when we're going to be showing more skin and wearing little sundresses and maybe bathing suits and things like that. So you would drink it for the 90 days and then maybe take a break and leave it off until you're getting ready to go on your Caribbean vacation, and you drink it for another 90 days. And it's just sort of one of those detoxifying, smoothing things that you would do. I'm sorry, getting a dry throat, that you would do whenever you were ready to, whenever you're getting ready to go show some skin. So, and it's a dark cherry flavor. That one sounds really good too. And so this is a lot of good information for you guys. I'm excited about all of this. The company, I think Sam's giving me some water. I just saw him outside. The company keeps this product authentic. Even though it's sort of a pain in the butt for us, we're very excited about this because you're never going to get Skinade off of the internet and it's counterfeit and it's not what it says it is, like you can with other products. So you have to be really careful if you're ordering products from somebody who is not a medical practice when you're ordering these products that are only to be bought from medical practices. That goes for your skincare products, like your SkinMedica and your Visions and things like that. If it's too good to be true, it probably is. Thank you, Sam. So that's better. So we can't put it on our web store for you because we talked to them and we said, you know, this is just special because we're kind of going through this whole COVID thing and we're making things more accessible. And they kindly said, no, I'm sorry. We would prefer you not to sell it if you're going to do that. So we're going to comply with that. And so what we have done for you is we have on our About Face Skin store, you will see on the left-hand side, you'll see where it shows the Skinade products, and you're able to hop on there and make your order, and it will be shipped immediately to your house. So you don't even have to come in to pick it up. It's shipped immediately in a couple of days straight to you. We also have it set up so that you can do a drop ship. So if you're a regular Skinade user, you would be able to say, okay, just drop ship me every 30 days. So I'm not having to come in and buy 90 days and find a place to store it. So you're able to get on there and just click a one-time purchase or once every 30 days. And we're going to set it up for you so that it's drop shipped and your card is charged every 30 days, which of course you could stop anytime you wanted. So we have all of the targeted solutions on there. You have options for 30, 60, or 90 days on Skinade, Clear, A&D, and Cellulite. And you also have the choice of either the bottles or the sachets with Skinade. Okay, and we wanted to give a little gift to you guys that joined us tonight. So only for the viewers that are here tonight, there are 200 opportunities. So I think everybody will get one. But the company said that for anybody that buys a minimum of 30 days of any of these products, so it can be Skinade, it can be any of the 3 targeted solutions, they're going to throw in 10 days worth of their travel sachets of Skinade for you. So these are awesome just to throw in your bag if you're going on vacation. They're so small, you know, they're not going to be in the way. Or if you're just on the go and you want to drink this at work, it's nice to have these little guys. So that's a $55 value for you if you order before tomorrow night at 8 o'clock. They wanted to have a little cutoff there so they didn't run out of product. I am sorry, y'all. So we have the order form on there. As I said, you can text us at the office number, send me an email, send us a Facebook message, any way you want to contact us, and we can help you with this if you have any extra questions that we didn't answer or something that we haven't thought of. We'll find out for you. We're going to be continuing our webinars once a month, and we may do a combination of Facebook Live and these more private webinars. When we do these more private webinars and you register, we're going to try to have a little perk for you that makes it worth your time to join us, such as the $55 value from Skinade. We're going to try to have some sort of little prize for you as a little treat. Since we can't have our parties in person and serve you nice drinks and food and grand prizes, we're going to do all that we can for you at home. So we thank you guys very much for joining us tonight, and look forward to seeing you again soon. If you have any questions, let me know. Thank you guys. Take care.